Physiology of hypocalcemia. Leads to secondary hyperparathyroidism, so increased PTH causes 1. 1-alpha-hydroxylase enzyme converts stored Vit-D to active form, which increases calcium absorption in gut. 2. Calcium reabsorption and phosphate excretion in kidneys. 3. Acts on bone cells, osteoblasts and osteoclasts. PTH cation on bone cells in response to hypocalcemia. PTH receptors are present on osteoblasts. On combining, it release rank ligand, which stimulate osteoclast to resorb bone. Which drug is rank ligand inhibitor? Denosumab. Primary hyperparathyroidism cause and pathogenesis. Cause, adenoma, resorption of healthy bone and simulation new bone formation, but even after normal cal level, no effective negative feedback on adenoma. So increased calcium, phosphate excretion. Mechanism of hyperparathyroidism due to renal failure, renal osteodystrophy. Due to renal failure, vitamin D activation doesn't happen, so hypocalcemia occurred, which stimulate PTH release. PTH causes bone resorption and release Ca, but this calcium is not absorbed by kidneys and hence calcium is excreted and phosphate is not excreted. Vicious cycle goes on, and due to formation and resorption of bone, multiple lesions on bones are seen. Lab findings in primary parathyroidism, secondary parathyroidism due to Vit-D deficiency and renal failure. Serum calcium, increased in primary, low in secondary. Phosphate, only increased in renal failure, rest rise. PTH, all increased. ALP all increased. Most common presentation of rickets. Bilateral genu varum. Thigh moving towards or away from midline is called toward, coxa vara, away coxa valga. Forearm moving towards or away from midline is called toward, cubitus varus, away cubitus valgus. Most common cause of bilateral genu varum in adult. Osteoarthritis greater than rheumatic arthritis. Radiological finding in rickets. Fraying ragged edges of bones. Cupping of metaphysis. Splaying of metaphysis. Widening of epiphyseal plate. Best method to check healing in rickets. X-ray and serum ALP. On X-ray white line of Frankel seen, which is mineralization of growth plate. X-ray finding of osteomalacia. 1. Sadofractures, milkman fracture, looser zone. 2. Protusio-acetabuli protrusion of head of femur into acetabulum. 3. Champagne bottle deformity, pelvis shape like champagne. 4. Triridiate pelvis. 5. Trefoil pelvis. Most common sites for milkman's fractures in osteomalacia. Neck of femur, clavicle, ribs, spula, pubic rami. Other conditions where milkman fracture or looser zone can be seen. 1. Hypothyroidism. 2. Paget's. 3. Fibrous dysplasia. 4. Osteogenesis imperfecta. 5. X-linked hypophosphatemic rickets. Treatment of osteomalacia. Stas regimen Vit-D given. Tumor-induced osteomalacia is seen in fibrosarcoma, osteosarcoma, osteoblastoma, non-ossifying fibroma. Effect on bone in scurvy. Collagen maturation doesn't happen because of Vit-C deficiency. Features of scurvy in bone. 1. Diaphysis ground glass appearance, plus pencil-thin cortex. 2. Metaphysis, white line of Frankel plus Pelkin spur. 3. Epiphysis, Wimberger ring sign. What's combined deficiency of Vit-C and D called? Barton's disease. Clinical features of hyperparathyroidism. Salt and pepper skull, resorption of lamina dura in teeth, subperiosteal resorption on radial side of phalanx, brown tumors in brain. Brown tumors aka, mechanism. Osteitis fibrosa cystica, or von Recklinghausen disease. Here due to breakdown of bone, cavities are formed, blood get filled and Hb breaks down to hemosiderin. X-ray finding of renal osteodystrophy. Rugger Jersey spine, alternating zone of increased and decreased bone density on spine seen. High serum calcium features. Bones, painful bones, stones, kidney stones, groans, abdominal symptoms, psyche overtones, lethargy, memory loss, depression, psychosis. Osteoporosis. Its porous defect in bone, normal quality but decreased quantity. Etiology of osteoporosis. Primary, postmenopausal and senile. Secondary, drugs, hormones, immobilization, space, rheumatoid arthritis. Drugs causing secondary osteoporosis. Steroids, heparin. Clinical features of osteoporosis. 1. Back pain, earliest. 2. Fragile fractures in spine, neck, femur, hip, cols. 3. Kyphosis, forward bending of spine. 4. Lab finding are normal. Radiological features of osteoporosis. 1. Codfish vertebrae or fish mouth vertebra or biconcave vertebra. 2. Wedging of vertebra, but X-ray changes seen only after 30% bone loss. Differential diagnosis for codfish vertebra. Osteoporosis, osteogenesis imperfecta, osteomalacia. Screening for osteoporosis is done at what age? More and equals 65 women, 70 men. Which test is IOC for screening of osteoporosis? DEXA scan, dual energy X-ray absorptiometry. It assess spine, hip and calcaneum. Scoring of DEXA scan. By T-score, 0 to 1 normal, 1_2.5, osteopenia. Below 2.5, osteoporosis. Below 2.5 plus fracture severe. First-line drugs for management of osteoporosis. Bisphosphonates, risedronate, ibandronate, zoledronate. Side effects of bisphosphonates. After 5 to 7 years of use, they decrease osteoclast activity too much, so atypical fracture around hip are seen. Other drugs for management of osteoporosis. 1. Teriparatide synthetic PTH, increase bone formation. 2. SERM and HRT. 3. Denosumab. Drug that increases bone formation and decreases resorption but has high complication. Strontium ranelate. Etiology of Paget's disease. Due to paramyxovirus infection, SQSTMI gene mutation. Paget's disease aka in pathogenesis, aka osteitis deformans. Increased osteoclast activity. Clinical features of Paget's. Pain, warm bone, around 50 years, weak bone, banana fracture, cranial foramen stenosis, so 2, 5, 7, 8 nerve involvement. Otosclerosis, thickening of skull, hat size change. Investigation for Paget's disease. IOC biopsy, mosaic pattern is seen. Common site for Paget. Pelvis greater than Radiological finding of Paget's. 1. Grass blade, flame-shaped femur. 2. Osteoporosis circumscripta of skull. 3. Picture frame vertebra. 4. Ivory vertebra. 5. Cotton wool skull. 6. Tam O'Shanter skull. Treatment of Paget's. Zoledronate, calcitonin for pain relief. Complications of Paget's. High output cardiac failure, transformed to osteosarcoma. Osteogenesis imperfecta aka in pathology. Brittle bone disease, COLA1 gene defect, genetically abnormal collagen. Osteogenesis imperfecta types. Type 1 AD, recurrent fractures. Type 2 AR, multiple fracture in utero seen. Lab values in osteogenesis imperfecta. Normal. Clinical features of osteogenesis imperfecta. Multiple fractures in same bone. Blue sclera cause of thin sclera, blue choroid visible. Easy bruising. Realignment osteotomies in osteogenesis imperfecta. Seek kebab operation.